I think that the smart consumer today is less dependent on traditional advertising, media, and will at least perform a search on the internet, and probably the most commonly is Google nowadays. But what should they be looking for? I mean, if you're looking for the best hair transplant, if you search hair transplant, you're going to find who is offering hair transplant, and who Google in the organic listing ranks as being the most pertinent, and the most relevant, I guess, for your search. It really doesn't distinguish between one provider and another. I think that the prospective patient really needs to look at what is representative of the provider, and only in really investigating and seeing a lot of before-after pictures is it possible to really gain an educated opinion as to what the different doctors are able to do in the different situations. It's more difficult in a patient with diffuse thinning who may not be obviously losing hair, at least initially. That patient really generally flies underneath the radar still, because he can style his hair in a certain way to cover up. The problem is when the wind blows, that patient is exposed, the thinning areas, or when the hair is wet. For example, they go swimming or they take a shower, they come out. This is very evident to the patient that he's thinning. Remember, as much as we hate the hair loss is very forgiving. It allows us to lose half our hair without detection that we're thinning. So in that kind of case, you want to see that the different provider are able to deal with that kind of problem, because this is a difficult area to really restore successfully. You want to see that, how much shock loss do they have in working in an area where there's a lot of remaining hair. It's very important to know how to work with that. Do they achieve results that show improvement, or are they shocking so much that it's a wash?